All right, so now we're going to explore the legal culpability of the pharmacist. Okay, so the indirect or direct guilt, right? The guilt, the absolute, the guilt in what, right? So these are birth control pills. Well, they will stop pregnancy. Well, no, they will not. They will not prevent the pregnancy. So the ovulation is happening, all right? The ovulation is happening, and the baby is fully viable. The small boy or the small girl will be conceived, and there's a new baby there. The baby boy or the baby girl will live for a number of days, about 9 days, until implantation. All right, so the baby's life is cut short by these drugs. Right, so the legal culpability of the pharmacist here. Are they guilty? Well, yes, certainly yes, certainly yes, certainly yes. So direct but indirect. A pharmacist plays a role in the process by dispensing abortion inducing drugs but does not perform the act itself, making culpability significant but secondary to that of the prescribing doctor. And let's make no mistake, number one, the I don't know if you can say the guiltiest person would be Dr. Michel Dow. Absolutely, the most culpable, right? And so would be the Dr. Michel Dow. So no knowledge of the drug's purpose. Unlike policymakers or pharmaceutical manufacturers, pharmacists are fully aware that they are dispensing medication intended to terminate a pregnancy, making them complicit in the act. Duty to refuse harmful prescriptions. Pharmacists, like doctors, take an oath to protect life and have the right to refuse and dispense medication on ethical or moral grounds. If they knowingly provide a drug that ends life, they bear responsibility. And we're not talking about any kind of medical assistance in dying here. We are strictly talking about um, birth control pills that will um, kill a and that's the thing that the babies are healthy. The babies are perfectly healthy, and there is no medical reason to end their lives. Medical assistance in dying. Well, the argument could be made: this guy's going to die. He's got all kinds of health problems. We're not talking about that. Okay, that's a slippery slope. A very dodgy issue. And last that I heard, it's extremely painful. The lungs, it's like a torture. The pain is like a level 11. The maid apparently medical assistance in dying maid is extremely painful. So very dodgy issue here, but we're not talking about that here. We're talking about birth control, which do not prevent the ovulation. It doesn't prevent the pregnancy. The baby will survive for 8 or 9 or 10 days, and then fail to implant due to these directly due to these drugs. Can I even call it a drug? I don't believe I can. So the mens rea, or the guilty mind. Okay, so the guilty mind is present. So unlike a policymaker who writes laws or a corporation that manufactures drugs in bulk, a pharmacist is directly involved in approving and dispensing the drug to a patient, making their intent more direct. So there's even more. So the politician is certainly guilty. The pharmacist is guiltier, but let's make no mistake, Dr. Michel Dow is the guiltiest of them all. Certainly guiltiest. I never actually heard that used in a sentence, but we can certainly use it here because it is very, it reflects the situation adequately. Um, Not just a middleman. So pharmacists are not passive participants. They must verify prescriptions, counsel patients, and ensure the proper use of medications. Their active role makes them legally and morally accountable. Could have chosen to opt out. Many jurisdictions allow pharmacists to refuse to dispense certain drugs on moral grounds. If a pharmacist knowingly participates, they willingly accept their role in the process. Enabling the crime certainly is it fits the definition of a crime. Without pharmacists providing access to these drugs, the act could not occur in a medical setting. There is a critical link in the chain of causation. That's a wonderful point. Right? If it wasn't for the guiltier pharmacy, the guiltiest doctor could not fulfill the murder. Um, could not fulfill the act could not be the death could not occur, I guess you could say. So that's the thing. So without these pharmacists, us read it again because that's a fantastic point. Enabling the crime. Without pharmacists providing access to these drugs, the act could not occur in a medical setting. They are critical. They are a critical link in the chain of causation. So what is the chain of causation? First, it's the politician, and then it would be the pharmaceutical companies, and then it would be the you know the signature on the prescription pad. I mean that's um, really the stuff of a thousand nightmares. And is that pen when she picks up that pen and she puts her signature on that prescription pad, that is the stuff of a thousand nightmares, man. It's really it's an egregious crime. It's the most egregious crime. And an accessory, let's finish this one up. Accessory to the act, while they may not administer the drug themselves, pharmacists can be seen as accomplices by providing the means to carry out the act. To administer the drug, there's some implantation there directly into the uterus and all that stuff. I don't expect to go very much into the actual administration of the drugs. Sometimes it's a pill, sometimes it's an injection, sometimes it will be directly administered into the womb of the woman and all this stuff. So there is there's a lot of there's a lot of stuff to talk about there. But what's important here in this video is the guilt. The guiltier pharmacist, but let's make no mistake, the guiltiest of all is, of course, Dr. Michel Dow, which is the subject of this whole YouTube channel. Thank you very much for tuning in. I'll see you in the next video.